And within a few months, his new company, GW Pharmaceuticals, became the only company in Britain licensed to develop a medicine from marijuana plants.
The prospects in 1997 and 1998 were to take a plant that had been a medicine but had fallen into disuse and turn it into a modern-day pharmaceutical.
To do that, Dr. Guy has had to grow a lot of marijuana, 60 tons of it a year. He had to buy special glass growing houses and high-tech processing labs. And for security reasons, he had to put it all in a secret location. But within a year, he had his modern-day pharmaceutical, a little spray bottle that shot 100 microliters of marijuana-derived liquid into a patient's mouth. He called it Sativex. Meanwhile, patients had been sending Dr. Guy thousands of letters.
My wife and I would read through them on a Saturday morning, and we would get hundreds of letters, and they were really very, very touching. But what the patients were saying was highly corroborated. It's as if many of them had sat round a very large table and decided what to write to Dr. Guy.
There's a huge unmet need there of patients who, for my part, running a pain clinic, are queuing up outside my doors saying, the rest of the drugs you've tried with me, medicines you've tried, techniques you've tried, don't work. When can I try this cannabis medicine?
Dr. Notcutt's patients were among the first to try Sativex in 2000 in clinical trials at hospitals around Britain. Trials that would finally answer the question, could marijuana be made into a modern medicine? According to Michelle Collin, who volunteered for a Sativex trial, it could.
Last 9 years, I hadn't been able to kiss my husband, hadn't been able to get my mouth around an apple, anything like that. But for the first time after being on the trial that I'm on at the moment, within a week, I had the first good snog I'd had with my husband in years. So he was very pleased as well.
When they told me that it was a liquid spray that was made from cannabis, I was quite surprised and rather apprehensive.
But Deborah Weeks was willing to try the drug, and within a few weeks she says she realized she was no longer in constant pain.
I didn't have to think about things beforehand, before doing them. Moving around was easier, standing was easier, walking was easier, and life in general slowly began to return to normal.
But the real test for Sativex was those patients who had made the medicine possible in the first place. Patients with MS. Peter Bridger is one of them.
We used to love walking in the country. We used to take the dog for a walk. We used to walk for absolutely miles. But of course along came the MS, and that's cured that. I can obviously no longer walk comfortably. I struggle.
Peter has all the classic symptoms of MS. His limbs drag, his speech is slurred, and he's gone partially blind.
Of course, the disease is progressive, so it is progressively getting worse.
MS is a disease that plays havoc with the human body, causing a kind of disconnect in the nervous system between what a person wants his body to do and what it actually does. And it is very, very painful.
If you can imagine that your leg is trying to bend back, at the same time it's trying to bend forward, you've got the two muscles fighting one another. That hurts.
In 2000, Bridger saw a TV program about the development of a drug based on cannabis. That very day, he volunteered to be one of the first to try Sativex.
I would love to say it has cured my MS and life is back to normal, and no, it's not. But by Christ, it did half help with relieving the symptoms.
As Peter Bridger says, Sativex is not a miracle cure, and it has had its setbacks. Although Canada has approved Sativex as a prescription drug, Great Britain still has not, citing a lack of evidence of its effectiveness in clinical trials on MS patients. In the U.S., Sativex is set to start clinical trials sometime this year. Just last week, the company sold the rights to market Sativex in the U.S. to a Japanese company for more than $300 million. Coming up next, scientists call it the marijuana in your brain. While some scientists are studying marijuana plants, others are studying what they call the marijuana in your brain, a system of chemicals and receptors located mostly in the brain that match the chemicals inside the marijuana plant.